Hey, Dr. Patino here at the Cosmetic Surgical Center for Cerritos. We're going to do micro air power assisted. Power assisted means this is like a toothbrush, but electric, right? So electric. The tip moves. Similar to a toothbrush. It's very similar. So you could do this with the old technique where, you have a toothbrush that is not like that and you can go in and out and get some gum bleeding, right? Here is basically the same thing. And you could also have this electric toothbrush and just go at it too. So, but the dentists tell us, just go slow, right? Let the tool do its work. I mean, that's what I tell surgeons too. Go slow, let the tool do its work, and look what's happening, right? And so it's not just that, but it's a combination. Look how my strokes are so slow, right? Very slow strokes, right? So it's, way slower than the average surgeon, way slower than the way I learned how to do this, right? I used to go at it too, and the output would be, red or pink or whatever. And we don't even need to have yellow output because she's not having a fat transfer, but anyways, we like it because the patients have less complications, less anemia or no anemia at all, because there is no blood loss, right? And so there is no blood loss. There is also no blood that's irritating the tissues, and the blood that irritates the tissues causes tissue reaction, fibrosis, nodularity, all kinds of problems, right? But look at this. This is where I can be here all day. And at the same time, and if you have, beautiful yellow output like this, right? Look at this. This is incredible, right? So obviously, the patient is not going to have anemia. The patient is going to have less risk of a hematoma, which is a collection of blood. Whenever there's a hematoma, collection of blood, you could have also the risk of infection. Although the risk of infection with this liposuction is minimal, because the incisions are so small, right? But I still like to keep my output nice and clean like this. The blood, when it's outside the blood vessels, irritates the tissues, and so they can cause tissue reaction. Scarring, painful nodules, complications that we just don't see here at the Cosmetic Surgical Center in Costa Rica. If you would like to have liposuction, power-assisted liposuction, in a bloodless manner like this, please give us a call, 510-525-7999. Operators are standing by. Look at how beautiful that part is. I'm going to let it go. Look. Nice, huh? Incredible. So this is the way we like to do it, very controlled manner. At the same time, because we're doing this slowly, then there is less risk of perforation of any bowel. Obviously, there is no bowel here, because these are the legs, right? But any internal organs, maybe any arteries, nerves, veins, whatever, right? And this is the way we like to do it. Notice, I can even use my left hand. I'm ambidextrous, of course, but like most surgeons are. But this is easier because I'm not going too fast. I'm just going slow. So even if you're a surgeon and you're not ambidextrous, you can probably use. And the nice thing about this is that it's also good for the surgeon because the surgeon is not going to sweat it, right? So much less effort to do this slowly and gently. Much less risk for the surgeon also of having tennis elbow, or we call it, I think epicondylitis, right? Or even tendinitis or whatever, And also fatigue, the surgeon gets fatigued if there is, they're doing this. And, another thing is that you can also do this, with the other hand. If you're not an ambidextrous surgeon, then you can do this easily with the other hand because you're doing slowly, right? And so even for those surgeons, most surgeons are ambidextrous. But if you're not, then You can do it with the non-dominant hand, and you know, it's good. I mean, this patient has a lot of irregularities on the outer side, the area, and this is an area that's very prone for irregularities, so I was very concerned about doing this case, you know, but she accepts the irregularities that she already has, you know, like the cellulite and stuff, so she's going to have that regardless, but we're just going to decrease the bulk of what she has, you know, just make it less bulky. Like for example here, I'm going to show you on this side how the pinch test is already, this is the inner thigh, right? And if you take a lot, also you're gonna have a problem. So, you know, she just doesn't like the legs rubbing when she's exercising. But notice the difference between this pinch test and this. I mean, there is a lot of stuff here, right? And yeah, we're toward the end of the procedure. We got maybe 10 or 15 more minutes. And look at the beautiful yellow fat still coming out on this patient. It's just incredible, right? And let me show you now what we got as far as the pinch test is concerned. So here, come on this side, so you can see. So these are the inner thighs. That's your pinch test on this side, right? See? And then here also is this is the pinch test. So you don't want to make it super thin because then she have irregularities. She has a lot of irregularities out in the outer thighs already, and we don't want to make that worse. But of course, with liposuction, irregularities can get worse, especially in the inner and outer thighs. More importantly, in the outer thighs. So we're going to be very conservative with the outer thighs, and still, she has many irregularities, and we cannot avoid them. But at least we want to thin this area, which is what she wants in this area. Thank you.